Cochlear implant is a device which is put in with a surgical procedure, and it consists of a internal implant which goes under the scalp, an electrode through into the inner ear, and then you have to wear an external speech or sound processor that allows the internal device to work. A child with a documented hearing loss who is already wearing hearing aids, if they're not developing normal speech and language, then the concern is that they're not getting enough benefit with the hearing aids. Those children are identified perhaps by Hearing Australia or by wherever their early intervention is, and hopefully get referred to us in the Cochlear implant clinic. And then we will then reassess their hearing level and do whatever further investigations are necessary to see if a cochlear implant might provide better hearing than the hearing aids do.
Once a child has surgery, families will be given a block of appointments, and that includes a combination of medical reviews, mapping appointments and therapy appointments with a speech pathologist. Approximately 2 to 4 weeks after surgery, the child's device will be switched on using an external sound processor, and the implant works by sending electrical current to the auditory nerve. So during a programming appointment, the audiologist will need to assess how much current the child needs in order to hear sounds comfortably, and this is referred to a map.
Did you hear that one? That was a big one.
VRA stands for Visual Reinforcement Audiometry, and it's a type of hearing test that we perform on babies and toddlers. With VRA, we actually condition the child to turn to a screen or a puppet as their reward once they've heard a sound. Audiometry is another form of test that we try with children 3 years of age and up, so preschoolers. So the child is trained to hold a toy such as a peg to their ear. When they've heard a sound, they'll then pop the peg on the board. With VRA and play audiometry, we're actually training the child to respond to the softest sound that they can hear. And this will allow the audiologist to know how much current to send to the electrode for the child to be able to hear soft sounds. Following switch on, families will be required to attend the clinic for mapping sessions, and that might be weekly to fortnightly for the first month or two. In every mapping session for young children, there's typically 2 clinicians present. There'll be an audiologist who will be at the desk behind the computer doing the testing, and there'll also be another clinician sitting close to the child to help them stay on task. During the early weeks after switch on, the child's map is still quite conservative, and by that I mean it's just audible but comfortable, and that's because we need to take baby steps in how much current and volume we send the child home with. Once a child's map is stable, the frequency of appointments will be less. They might be stretched out to every 6 weeks to every 3 months. Eventually, when the child's at school, again, if the map is looking stable, mapping appointments might only be annually by then.
Okay, we'll have a look. My special light again. Have a look in your ear, there we are. For children who have had a cochlear implant, the routine would be to check their ears are healthy, make sure the eardrum is intact and there's no problems, that the middle ear is clear, and also to be sure that the site of the surgery behind the ear is well healed and no problem.
During the first few months after switch on, the child will also have therapy appointments with a speech pathologist here at the clinic, and there are 2 main goals during those sessions. The first one is to educate families on how to care for the child's processor, but also giving them strategies about how to create a good listening environment for the child at home, as well as strategies to get their child to learn to listen. Obviously, the second goal is working closely with the child to get the child to learn to listen with their sound processor. I'll always be asking how the child's progressing with their listening and speech skills, but also for very young babies, I'll be asking how the child's actually going wearing the device. Keeping the device on little ears is quite challenging for all waking hours, which is what we're aiming for.
Time to go.
It does take time for the brain to learn to listen to a new signal, and that's why therapy is just as equal as important as the mapping session.
Particularly we want to know that the child is progressing with their speech and language as expected, and so we're interested in what their schooling is, what their progress is, and make sure that everything is going as expected.